How are we going to survive? To make money is not easy.
People are dying because they can't afford the fee.
No, they do the checkup, but the thing I observe is that they don't have drugs.
I just read daily on IT students, new students, CWE students, just to come and be attending. So they don't also have time.
I have no choice than to just plead, just please save my life. And then no one to save my life.
That the person who is going to do the transplant in the UK may also be a Nigerian, leave their country to another person's country to perform what would otherwise be a life-saving operation. And look at where it's ended. Just because we have failed to provide for ourselves.
Trust me, every Nigerian has a personal story to tell on this subject. We have people flying out of the country for treatment, and I keep wondering the possibility of having our healthcare system being built up enough to make people feel safe and assured of getting a world standard healthcare service anytime they need a ride. So the question is, why can't we have a healthcare system built up that people can confidently fly into the country Nigeria for healthcare because they know they will find a quality service in terms of treatment and attention given to them? Hi everyone, I'm Ayodele Joka. I'm a visual storyteller and my core passion is to give quality story, bring together the story of Nigerians as regards the healthcare sector and anything that can improve the quality of life. According to the World Health Organization Health Performance Ranking for about 191 countries, Nigeria used to be ranked 187th and leaving just 4 countries behind. However, it has been improved over time and currently ranked 153rd position in the whole world. So, is this report what we want for our country? Or it can still be improved to the world standard that the whole world can be proud of? Actually, there's no way we can get the truth behind this without asking the people that feel they hate the most. What are this set of people? These are the people that are helpless, they're strengthless, they have not what it takes to protect themselves, the finances is not there, they lose their family daily to simple ailments that could have been treated easily if there's a provision for basic amenities in terms of healthcare system that could have protected our citizens. They lose their family every day. They cry every day over this and there's nothing they could do about it. You know, some other persons can afford getting to private hospitals or even leaving the country to get their health settled. But these ones have nowhere to go. Let's get on the street and ask our beautiful Nigerians how it feels like to be helpless and losing your loved ones daily.
I was once sick then, so I was rushed to the hospital. Getting to the hospital, I was like, I should be given a bed to just sleep and take good care of me. So maybe 3 hours to that time, nobody have attended to me, even though just common paracetamol has not been given to me. I have no choice than to just plead, just please save my life. And then no one to save my life.
What should be paramount to our medical personnel in this country is safety first. And if they consider safety first, then money can come thereafter. Because how do you explain it when somebody will come to you for health issues and the person pass out? Then where is the money? You can eventually not get that money.
So another major issue that we need to address, the government need to attend to, is the unavailability of drugs in most of our government hospitals. I mean, in case whereby patients are being diagnosed of what was wrong with them and then no drugs to be given to them. So the pharmacists now writing out drugs for them to buy outside the hospitals. Some patients actually ended up buying wrong drugs, fake drugs, expired drugs, and this can actually be detrimental concerning the health of the patient. It makes it worse. Some vendors outside don't actually know what drugs works for that, and then just be like, oh, if we don't have this, then this can work for it. Maybe end up giving them drugs that are meant for headache to treat stomachache. That's killing.
The thing I observe is that they don't have drugs. At least when you go to a clinic, in fact, a government clinic for that matter, and you don't have drugs to at least to give to people to use, that is something. In fact, I don't know how to describe it, but it's not perfect, not okay enough.
Some people, even when they get there, some cannot even afford the money for the card, let alone after seeing your doctor, they ask you to go and buy some drugs. And some drugs you may not even get it in the hospital. You have to get looking for it in pharmacies outside, whereby some will run into fake pharmacies and get wrong drugs.
Do not forget to click on the subscribe button, like, and share to your loved ones. Also click on the notification bell so that at any point in time we release any useful information on this channel, you'll be one of the first person to get it. And trust me, it's about how you can improve your quality of living.
The story I had then was when I went to the hospital for a complaint, and I spent over 5 hours before I could see a doctor. And what made me to spend over 5 hours? I got there by 6:30, but people that has connection were the people they were attending to. They attended to me around past 5. When they attended to me, I had to go and run some tests and do some other things. Before I could finish, it was so late. Right from that day, I decided within my heart that would be the last day I would go to a government hospital. So since that time, I've been going to a private hospital.
My wife, if I want to go hospital, I will use private hospital. I want to spend my money there, because if you go any other hospital, any government hospital, so if you go there, I want to see doctor, the doctor not around, so I don't like government hospital. I wish to go to private hospital.
There's nobody knows us. Once they born us, we are not even valuable. Our government is not valuable to us. We are not valuable to them. So we are just living out the way we like. There are many rumors that will give us something like that. There is nothing they are doing for us.
On the part of the medical practitioners, can the whole blame of the healthcare system problem be put on them, or it is that the facility needed for them to do their work effectively is not provided? I mean, in the part of the government. Another way it can be looked at is the kind of mindset our medical practitioners has, according to the comment of most Nigerians on the street. Is it the part of levity, carelessness, nonchalant attitude to loss of lives, and our brothers and sisters are dying daily? All that also, it can be unfair on the part of the medical practitioners that the system in the country doesn't favor them, doesn't compensate their years of investment in the university as an undergraduate to learning how to save lives. And they feel like, I've invested so much, but the system here doesn't pay me. I have to leave this country to another country where I can feel good and well compensated for what I've learned so far. And these also leading to the shortage in the number of healthcare practitioners ratio to the patient ratio. Still, let's listen to what Nigerians have to say about this.
And for the consultants, the doctors, the medical personnel, the workload on them is too much. You can have maybe 10 doctors that will also attend to like 500 patients. You see the queue. Some patients will have been there early in the morning around 6. Some even get there by 5 a.m. Till 3 to 4. The workforce load on them is too much. Some of the workers, the health workers, even collapse and die. I've gone through it for many years, more than 10 years. If you get your session, once you don't eat at home, by the time you start work, it will be difficult for you to eat. But as a result of that, many of the health workers are even having health issues. Even that they are dying for the masses at the expense of their own life, taking care of people, not neglecting their own self. So government should look into so that our personnel, our health workers will not be traveling abroad. Because when you get there, you get enough cash with little workforce. But here, I can't deceive you, my brothers. Let's cut the story short. We are facing a lot.
They're actually trying their best though. They're trying their best. But I feel like they should put more empathy, sympathy, and emotions into it. Because every patient that comes into the hospital, they are not coming because they derive joy coming into the hospital. They are coming basically because they have a problem, and the healthcare practitioners are in need to solve their problems, because we are really lacking on several. You go to some hospitals, they'll tell you because we don't have this particular equipment, we have to refer you. While at that, patients tend to die on the way.
I think it's not about the facility. It's about the people individually. How they can be proactive to attend to things. How they can stop things not to happen. What about if you have that facility and people are not ready to work? There are some situations where people don't even know how to make use of that same facility. They forget a lot of things when they are at work. And what do you do about them? When somebody working forget something during operation. So a lot of things happen. So at times you can't really say, oh, it's all about facility. No, I think it's all about individual. Check it these days. All our doctors and whatsoever, they don't really concentrate on health alone now. They concentrate on different types of businesses. Also, the nurses you are having, most of them are not competent. Those that are competent, they are not paying them. So they are just bringing new IT students, new students, CWS students, so just to come and be attending to people. So they don't also have time, you know. When you are employing people that are not ready to work, you see a lot of doctors, they will just ask you, have they paid? They have not. I don't think I have time. Why? Because people don't really count mortality of human beings as anything. They see it like when a chicken is dying. So it's now part of them. Like when they are at work and somebody just drop, you just hear that man has packed, that woman has packed. So they don't see it as something. It is we that we are not in their line, that we are saying that, oh, life is more important, this is more important. They don't see it that way. They just see it as normal.
There are some even health personnel that are not even qualified because they have people at the top, the politicians bringing it. But when you go out, you see some people that are more qualified, but they are unable to get the government work because they don't know anybody. We have a lot of people outside that are even health workers, both nurses, pharmacists, doctors, that are looking for a job. Some of them are working in private hospital, and they have this IQ that they can deliver, but nobody to put them in the government's work. Government to just look into everything and ensure that people that are being employed merit the job, not that I know person. So they should give an open employment and let them be tested. Yes, everybody should apply. Then if you can defend what you carry, let them get into the job. We have people that can do the job out there. Look at the youths that are doing Yahoo. Can't you use their brain? Let them bring it them in that Yahoo, something that they are doing on their system. You can create it something IT. Then you still equip them. People from overseas, let them train them the more. Put them, they can use that brain, what they are using to do all these things, just to earn a living, to add to the economy.
And what I will advise government, whenever you fix anybody in a position on a seat, please financially let that person receive what they are working for. Not that you work like elephant and you receive peanut like ants.
I would encourage the health sector of our country to give our medical personnel a reorientation as to considering safety of the citizens first before considering money. This applies to both government and private. Because how do you explain it when somebody will come to you for health issues and the person pass out? Then where is the money? You can eventually not get that money.
I have an experience. That was our ex-governor. The man, this guy, telling people he has an emergency, it's an emergency. They left him there about 3-4 hours like that. No one have attended to him. At the end of the day, they are like, who is this on the ground? So many people, Baba, we are coming, not until the man stood up himself and removed all the things he has on his face. And he let them realize, I am governor, so. That governor have to dismiss everybody to one post that very day.
And government know how to do that. If it's a private sector, there's a way they can run it. Once they realize what they are doing, they can decide to close their hospital. If it is public sector, there's a way they can sanction those people there. It is government paying them. But when the government is not also ready, we face the same issue.
There should be something like a first-stage treatment for people that will come. Even if they did not see the relative of that person, they should still attend to that person before the relatives could come around. By the time the relative come around, they will definitely pay. And government also should provide at least some drugs that they think that these people can easily use for people before their relative come around.
They should try as much as possible to equip our remote clinics, health centers with some of these facilities. And I'm sure that when these things are put in place, it will prevent the mortality rate we experience on a yearly basis.
I want to suggest that all these NHIs should be something that they will bring openly for people, that even a layman should register for it, and we should enjoy the health insurance scheme. At least if we are paying 10% for all these things, it will go a long way in helping us, because the country is not so smiling that people will not be spending extravagant amounts on their health.
In fact, if these things should continue to the next 2 or 3 months, anything can happen in Nigeria. Please kindly help. Thank you.